So cancer and bone metastases. So bone metastases often occur at the development and advanced stage of cancer, so stage 4. It's the third most common area for cancer to spread to, other than the liver and the lungs. And it's basically cancer within the bones that disrupts that normal cycle of bone growth and breakdown, which creates many health complications, which I'll touch on in a moment. But who is more at risk? So solid tumour cancers, so things like breast and prostate, kidney, ovarian, melanoma and thyroid cancers are higher risk of developing bone metastases at an advanced stage. So the position statement that I showed you before in 2019, impact training is not recommended for those with bone metastases. So that's a real difference on the guidelines before about impact exercise being introduced to all those people to manage bone density and potential osteoporosis. So it's impact loading is contraindicated for patients with bone metastases, and that was the 2019 guidelines. So the considerations and limitations with those with bone metastases can cause pain, not necessarily, but they can. It increases fracture risk because of that imbalance in our bone growth and loss. You can have spinal cord compression, which can result in nerve damage and potential paralysis. And hyperkalemia, which is a leaching of calcium from the bone into the blood, which can create many other health complications. So there's lots to consider with this patient, with this population. So again, the exercise guidelines from 2019 is that impact training is not advised. But what is the emerging evidence and research? In 2013, so a bit earlier, there was a mouse study done where mice were injected with metastatic breast cancer cells into their tibia, so their shin bone. And some of the mice had a compressive force applied to the tibia bone that was similar to impact training over a 6-week period. And what the research showed, so this is a slide of scans of the bones, the mice's bone, the mice bone. And so the group that didn't do the loading showed significant degradation of the bone and progression of the cancer within the body. So this was the bone. So these are all similar images for the mice that didn't do the loading. For the mice that did do the loading and were injected with the breast cancer cells, it inhibited this response on the of the bone degradation. It also reduced the inflammatory markers, which are a precursor to progression of cancer disease and cancer progression within the body. So this, mice models. So again, what can we do with this? Well, it's cautious optimism. More research is needed, and we are going through these processes now. Last year, there was a systematic review, which is like a collection of studies that reviewed all the different studies that have been done with those with bone metastases, and a lot of them did not include impact training, well, none of them included impact training. There were a few that had soccer training in their measurements, but essentially they weren't prescribed any impact training because that's still not advised. But essentially the collection of this data and the advice around exercise for those with bone metastases is that we need to weigh up the benefits versus the risks. If we tell these people not to exercise, what else are they going to lose in their health? And what other complications are they going to have with not exercising at all? So it's appropriate to prescribe, appropriately prescribed exercise in resistance and balance is still highly recommended for this patient population. That we use caution and close monitoring with specialists, a treating team, and your exercise physiologist or trained professional to monitor symptoms, and that there's greater emphasis on postural alignment, controlled movement, and proper technique, which I'm sure you hear Lauren, Benji, Dale, and I harp on about all the time. So in summary, bone loss affects everyone as we age. Hormone treatment significantly increases our chances of osteoporosis. Targeted exercise is recommended as part of the best prevention and management of osteoporosis, so impact training, resistance and balance. But it's not a one-size-fits-all model, so seeking professional guidance is essential. that impact exercise is not currently recommended for those with metastases, bone metastases, but the emerging research shows that impact exercise may be important in reducing further bone loss and cancer progression. So stay tuned.